I have proudly called Australia home for the last 2 decades. Not that my accent changed much, and I hope you can understand me okay. So today I'm presenting the interim evaluation findings for DVassist Healing and Recovery Counselling Services, covering July 2024 to June 2025. These findings highlight the impact of our counselling service model in regional, rural and remote Western Australia, and where the needs are emerging as demands continue to grow. And before I begin, I would also like to acknowledge the traditional owners and custodians of the lands we are meeting from today, and pay my respects to elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. We acknowledge the ongoing impacts of colonization, dispossession, and systemic racism, and the strength of Aboriginal women, families, and communities who continue to lead healing, safety, and justice across regional Western Australia. Today's presentation discusses family and domestic violence, and some content may be triggering or uncomfortable, so please take care in whatever way you need. You're welcome to pause, step away, or reach out to the supports that are listed here, 1-800-RESPECT and DVassist. Now, DVassist is a grassroots organization based in Western Australia, dedicated to supporting people affected by family and domestic violence in regional, rural, and remote communities. Founded in 2017, DVassist began as an online directory connecting WA's rural and remote communities to essential family and domestic violence support services. From these humble beginnings 8 years ago, DVassist has grown into a comprehensive specialist family and domestic violence service. Today, we operate across 58 shires in regional, rural, and remote Western Australia, covering 85% of the state's landmass. The shires DVassist operates in are highlighted in orange on the map, and the purple areas show the shires we have yet to expand into. Now, many communities across the regions face significant barriers to help seeking. There are long travel distances, limited or inconsistent services, privacy concerns, and the visibility that comes with living in a small town. DVassist's commitment remains true to its founding vision, ensuring that every person, no matter where they live, can access the support they need to be safe, recover, heal, and rebuild their lives beyond family and domestic violence. Our core service is healing and recovery counseling, delivered by specialist family and domestic violence counselors via phone and web chat. This ensures people can access confidential, trauma-informed therapeutic support from wherever they feel safest, whether that is at home, at a farm, in a small town, or from another private location. In addition to phone counseling, DVassist offers brief case management, warm referrals, and ongoing follow-ups to help clients navigate specialist family and domestic violence services, legal support, housing, financial counseling, healthcare services, parenting supports, and community programs. We also provide web chat support, online therapeutic groups. Actually, this is a new initiative due to launch in February next year, and regional recovery and healing retreats that support connection, emotional recovery, and link people to local support and services. Alongside our counseling services, we deliver community education, training, and workshops, building the knowledge and capability of regional workforces to respond safely and confidently to family and domestic violence. Today, I will cover 5 key areas. First, DVassist's role in regional, rural, and remote Western Australia. Second, how the evaluation was conducted. Third, what the evaluation found across the 5 client outcomes. Fourth, case studies and broader system insights emerging from regional contexts. And finally, the implications and funding needs moving forward. At the end, I hope there will be times for some questions. Now, before I discuss DVassist healing and recovery counseling, I would like to briefly talk about the broader concept of healing and recovery from family and domestic violence. While crisis support for women experiencing family and domestic violence is critical to their safety, healing and recovery are equally important. Women without long-term support and strategies to heal and recover may result in returning to the person using violence or continue to struggle with the negative impacts of the violence and abuse. Recovery and healing have been included as one of the 4 domains in the National Plan to End Violence Against Women and Children 2022 to 2032. Recovery and healing is a critical component of the plan, which importantly recognizes that even after the violence has ended, the effects on women's health and well-being continue. Women often need lifelong support to recover and heal. Recovery is an ongoing process that enables victim survivors to be safe, healthy, and resilient, and to have economic security and post-traumatic growth. And recovery also relates to rebuilding a person's life, their ability to return to workplace and community, become financially independent and secure, and participate socially in life. However, it must be acknowledged that victim survivors recover and heal in different ways, with some people being unable to return to work and requiring ongoing support. DVassist Recovery and Healing Counseling is a specialist, trauma-informed service designed to support people as they process, recover, and heal from the impacts of family and domestic violence. It is accessible, culturally safe, and shaped by each person's goals, voice, and readiness. Counseling sessions may include emotional support, education about family and domestic violence and trauma, grounding and coping strategies, safety planning, therapeutic goal settings, and decision-making support. We also help clients navigate systems and build self-care strategies that support emotional recovery. Everything is paced according to the client's readiness and is guided by what they feel safe to explore. One client's powerful reflection on the difference DVassist counseling made. DVassist gave me the space to be vulnerable, to unravel, and rebuild in my own time. My counselor walked with me through the dark until I could find my own light again. What FDV looks like in regional, rural, and remote Western Australia? Family and domestic violence remains significantly more prevalent in regional Western Australia. Remote women are up to 24 times more likely to be hospitalized due to family and domestic violence. And several regional police districts record among the highest family and domestic violence incident rates in the state. These realities shape the emotional load, the complexity, and the safety concerns that women bring into counseling. So, why phone-based support matters in this context? Phone-based counseling reduces many of the barriers that regional people face, such as long distances, lack of transport, privacy concerns, limited or non-existent specialist services in the local area, shift work, childcare responsibilities, or safety constraints that prevent attending appointments in person. Western Australia's vast geography creates challenges that go far beyond distance, impacting safety, access, and privacy. Distance to essential services create barriers beyond just the physical travel for women experiencing family and domestic violence in regional, rural, and remote WA. Distance compounds isolation. And it's not just about kilometers, it's about access, safety, and visibility. Many women don't have access to private transport, and public transport options are limited or non existent. Even if they can travel, doing so may alert the perpetrators or others in the community. Services may be hours away, and in some cases, they simply don't exist. This lack of proximity means fewer opportunities for early intervention, longer wait times, and increased risk. It also affects access to legal support, medical care, and safe housing, all critical components of escaping violence and recovering from family and domestic violence. In small towns, privacy can be a luxury. Everyone knows everyone, and that familiarity can be both comforting and dangerous. Women may fear being recognized when seeking help, especially if the perpetrator is well known or is a respected community member. They feel they may not be believed. There's also a lack of anonymity in accessing services. Walking into a local clinic or police station can feel like a public declaration. Additionally, services are often under-resourced, and there may be no specialist family and domestic violence support available. Women may have to rely on generalist workers who, while well-meaning, may not have the training to handle complex cases. Furthermore, many women in regional towns worry about gossip or being recognized if they seek help. It's one of the most common barriers we encounter. The fear of being judged, talked about, or having the situation become public knowledge is deeply ingrained, and this fear can delay help seeking or prevent it altogether. And this is why DVassist offers remote counseling. So victim survivors can speak to someone outside their community in a safe and confidential way without being visible in their community or traveling long distances. People can access counseling from anywhere, even in communities without family and domestic violence counselors, or where attending a local service may not be safe. Sometimes clients call us while sitting in their car or at a park. Our web chat support is particularly helpful when women cannot talk for safety reasons, or have auditory impairments, or simply are reluctant to reach out or engage with the service. The web chat and the phone counseling provide privacy, flexibility, and safety, especially in small towns where anonymity is impossible. So this interim evaluation was conducted by Social Impact as part of a 2-year evaluation of our specialist family and domestic violence counseling services with a focus on recovery and healing. It examines how well DVassist counseling model is working for regional, rural, and remote clients, and assesses progress across 5 key clients' outcomes. The evaluation explores both client outcomes and how the model operates in practice. It examines patterns across clinical work, client journeys, staff insights, and regional contexts to understand the service's broader impact. The evaluation included 16 client case studies, 1 client interview, 2 staff focus groups, 3 stakeholder interviews, service activity data, and website analytics. Together, these data sources provide a clear picture of how counseling supports people's recovery and healing across regional, rural, and remote WA. Limitations. Only 1 client interview was achievable, which is not uncommon in family and domestic violence evaluations. Safety concerns, emotional fatigue, and ongoing legal matters often make people hesitant to participate in interviews. However, the combined data provides a strong, consistent understanding of the impact. I will now walk through DVassist model of care and the service activity for the period July 2024 to June 2025. Our service model is trauma-informed, culturally safe, person-centered, and regionally tailored. It incorporates a no-wrong-door approach, immediate access, flexible delivery, warm referrals, and proactive follow-up. The model is closely aligned with state and national family and domestic violence strategies and is designed specifically to reduce access barriers for regional, rural, and remote people. This snapshot shows the volume of counseling contacts, follow-up calls, web chats, and multi-session work completed over the evaluation period. It reflects not only demand, but also the intensity and continuity of support provided to clients across the regions. During July 24 to June 25, it was recorded a total of 330 incoming calls, 161 referrals, 551 multi-session counseling sessions, 242 one-off interventions consisting of 41 single-session counseling, 106 case management sessions, and 95 web chat. These numbers should be viewed in light of the fact that we only had 1 counselor per shift due to funding constraints. Client demographics. Most clients are women aged between 26 and 45. We support a meaningful proportion of Aboriginal and culturally and linguistically diverse clients, and nearly 1/3 report living with disability. Many clients face multiple overlapping challenges, including housing instability, financial strain, isolation, mental health concerns, and parenting pressures, all of which shape the healing and recovery process. Referral pathways. Most clients self-refer or comes through other family and domestic violence services, which shows both accessibility and sector trust. Our warm referrals most commonly link clients to family and domestic violence services, legal support, financial counseling, health services, and community programs. These pathways are essential in helping clients rebuild safety and stability. I will now walk you through the 5 client outcomes measured in the evaluation. The evaluation focused on 5 outcomes as follows. 1. Immediate access to family and domestic violence healing and recovery counseling. 2. Access to resources and support services to meet healing and recovery needs. 3. Increase self-care knowledge and strategies that promote healing and recovery. 4. Feeling safe and supported. 5. Increase in mental health, psychosocial, and physical well-being. These outcomes reflect the core elements of counseling and briefcase management. Together, they offer a holistic picture of healing and recovery progress. Outcome 1, immediate access. The evaluation found that DVassist provides timely, low-barrier access to counseling and briefcase management regardless of location. Clients receive support quickly, including safety planning when needed, which is essential in the early stages of living an abusive relationship or managing instability. One of our clients recently shared, to be turned away from so many services because you're not in the catchment and to be left floating in the middle of nowhere, this just adds to your trauma. I would like to share a brief case study that illustrates how immediate access to counseling can make a critical difference during a period of heightened risk and vulnerability. A 39-year-old woman living in a remote town contacted DVassist in severe distress due to ongoing abuse. She was overwhelmed, emotionally heightened, and unsure how to keep herself and her baby safe. Initial support provided. The counselor supported the client to regulate emotionally, explore safety planning, and encouraged her to schedule an intake and assessment session for an in-depth risk assessment before commencing multi-session counseling. Subsequently, during the first counseling session, the counselor introduced the cycle of abuse and coercive control concepts and explored patterns and behaviors of both the perpetrator and the victim. The counselor also affirmed client's effort to protect herself and her baby, used a person-centered approach to separate client's identity from the abuse, provided validating language that gave client relief, with the client saying that she felt heard and understood for the first time. A second counseling session was scheduled to continue with psychoeducation, enhance safety planning, and develop strategies to reduce risk. However, the client disengaged due to instability in her circumstances. This case highlights how immediate access to support is essential, even when clients are unable to engage long-term. The second outcome, access to resources and support. The evaluation found that 94% of clients increased their knowledge of where and how to access support. Clients were linked to housing, women's refuges, financial counseling, legal support, grief counseling, mental health services, and community-based supports. Warm referrals reduce confusion, strengthen safety, and helped clients feel less alone as they navigated multiple systems. Outcomes 3. Increased self-care and recovery knowledge. Clients reported gaining a clearer understanding of trauma patterns and responses, improved emotional regulation, and greater capacity to use self-care practices that support their healing and recovery. These skills help women stabilize, reduce overwhelm, and have the confidence to make their own decisions. And here's how one client described their counseling experience. It's not just a sit on the phone and talk for an hour. It's productive. You can talk, you can ask questions, and you can learn. These graphs highlights the strong improvements clients made in coping strategies, trauma understanding, and emotional stability, with most clients reporting noticeable or significant improvement in their knowledge. Outcome 4. Feeling safe and supported. When support is consistent, people start to feel secure. It's not just about one-off help in crisis. It's about knowing someone will be there week after week. That reliability creates trust. Validation is another key piece. Many clients feel they don't deserve support if they're not in immediate crisis. When we reassure them that they're worthy of support at every stage, it helps to reduce shame and builds confidence and self-worth. And finally, grounding and emotional support are essential when someone feels overwhelmed. Emotional support complements grounding by creating a safe space where clients feel heard and understood. Together, these approaches reduce anxiety and give people the stability they need to start moving forward. In counseling sessions, clients spoke about feeling emotionally safe, validated, and believed. They described counseling as a place where they could be honest, process what they were experiencing, and regain confidence. And now I would like to share a longer client quote, as this client's words capture so well what feeling safe and supported looks like. Knowing that the service is still there and they're still going to call you every week, even though you might not be fighting for your goddamn life. You have the opportunity to breathe and repair and maybe learn something about your fight or flight pattern. I said, I feel like I don't deserve this service because right now I'm not in crisis. And she, the counselor, was like, let's work on self-work then this week. You're so used to accessing the service because of crisis that you become a bit scared to use the resource because you're not in crisis. But then it's a whole person approach. Like our service is here to support you. That doesn't mean that you have to be in crisis to be supported. I would also like to share another brief case study. In this example, the client, a 30-year-old woman living in a rural town, had recently separated from a partner who used coercive and control behaviors. From her first counseling session, the client described feeling safe, heard, and understood. The counseling space offered her relief and validation and helped her begin making sense of the abuse she had experienced. Across 3 counseling sessions, the client engaged strongly with grounding and stabilization strategies to help manage anxiety and overwhelming emotions. As trust developed, the client felt able to speak openly about her family violence experiences, including generational patterns, cultural pressures, and the long-term impacts of trauma. She reported feeling less alone, more supportive, and increasingly confident in setting boundaries and recognizing manipulation. This case study demonstrates outcome for the the importance of emotional safety, validation, and consistent therapeutic support in helping clients stabilize and begin the healing and recovery. Outcome 5, increased well-being. 87% of clients reported improved well-being on exit. Clients described clearer decision-making, better coping, strengthened boundaries, and a renewed sense of confidence and hope for the future. In this example, a 47-year-old woman residing in a regional town self-referred for multi-session counseling following a recent separation from an abusive partner who used coercive control. The client engaged in counseling to understand the impact of his behaviors on her well-being, her identity, and her daughter's emotional safety. Across 10 counseling sessions, the client rebuilt her sense of self-worth and identity, strengthened her boundaries with the perpetrator, and increased her confidence in making decisions that supported both herself and her child. She developed insight into trauma responses, challenged self-doubt, and gain confidence in handling future correspondence and legal matters. She described feeling more empowered, more hopeful, and more connected to her personal strengths as the counseling progressed. This case demonstrates the improved well-being, increased confidence, and strengthened sense of self captured in the outcome 5. Now, I would outline some of the broader systemic factors shaping women's experiences of counseling in regional WA. Clients in regional WA are navigating complex, intersecting pressures. Some of these include housing shortages, limited access to services, cultural and visa barriers, privacy concerns, and system delays. These realities influence what women bring to counseling and shape their emotional capacity and stability. Phone-based counseling helps reduce some of these pressures by offering flexible, accessible support. Many clients bring a long history of managing safety, coping with coercive control, and navigating instability. These experiences impact emotional regulation, confidence, identity, and self-worth. Healing and recovery counseling provides space for grounding, processing, understanding patterns of abuse, and rebuilding connection with self. I will finish with the key implications and funding needs emerging from the evaluation. Current capacity constraints. Our service demand now exceeds our current counseling capacity. At the time of the report, DVassist were providing 4 counseling days per week. This has since increased to 5. However, without sustainable funding to continue to meet demand, we may need to introduce a wait list. But this would directly affect outcome 1, which relies on provision of immediate and timely access to support. To continue delivering ethical, safe, and timely counseling, stable funding is essential. To meet the regional need and maintain immediate access, we need expanding counseling hours to include Friday evenings and Saturdays. We also need additional counselors and sustainable funding. We need to strengthen referral partnerships and continue building capacity across regional workforces. These steps will ensure women in regional, rural, and remote WA continue to have safe, immediate, and appropriate access to specialist family and domestic violence counseling. What this evaluation tells us: despite the limited number of client interviews, the convergence of case studies, client quotes, service activity, and stakeholder insights tell us a strong, consistent story. DVassist delivers accessible, trauma-informed, and culturally safe specialist counseling in regions where local services may be limited or unavailable. The service model is effective, needed, and making a significant difference in people's healing and recovery. Thank you so much for your time today and for your commitment to supporting victim survivors across regional, rural, and remote Western Australia. As we mark the 16 Days in WA campaign, your efforts play a vital role in creating safer communities and driving change. I'm happy to take your questions.
Thanks, Ella. Thanks for outlining the essential service that you provide to women who would otherwise not have a service at all, and for also outlining the barriers that women in these communities face. If people want to pop their questions in the chat, I do have a question though, Ella. One of the disturbing slides that you put up earlier referred to the high prevalence of FDV in remote communities, and I presume Aboriginal communities. So is your service suitable for Indigenous women?
Yes, absolutely. Although obviously the service is not necessarily the best option for everyone. We do have many Aboriginal women contacting us stating that they prefer a service that is not locally based, someone who doesn't know their business, because they feel they won't be judged that way. Sometimes we have the local Aboriginal services referring Aboriginal women to DVassist, and they liaise as an intermediary. We also offer the option of an interpreter, but what we hear again and again, Aboriginal women do benefit from having someone compassionate and non-judgmental and walking alongside them to find out what's most relevant and suitable for their situation and circumstances.
Thanks, Ella. Now, something you didn't mention, and I know part of your service is workplace training. Do you want to spend a couple of minutes talking about what topics you cover, how that works, and where you do that type of training?
Yes, absolutely. So we deliver a variety of training on family and domestic violence topics, as well as trauma. So some of the training is very introductory and is open to anyone who is just starting in community services. But we provide a lot of in-depth and specialist training for frontline workers and professionals that directly support victims, survivors of family and domestic violence. And some of those topics include risk management and safety planning, coercive control, understanding the help-seeking decisions of women impacted by family and domestic violence in regional, rural, and remote Western Australia. We also have a training about the trauma and trauma-informed approaches in the context of family and domestic violence. We do introductory training about primary prevention as well as bystander interventions. Now, this training is for anyone in the community, any workplaces, not just social services. Some of this training is actually pre-recorded and can be accessed for free via the website. But we also travel a lot across regional, rural, and remote Western Australia to deliver the training.
Thank you, Ella. Thanks everyone for your time today. Carol's put in the chat the slides, and also you could probably have access to the report, and we will also send everyone a link to pass this webinar on. Thank you very much all for your time, and thank you, Ella, and good luck with the rest of the 16 days.
Thank you so much.
Thank you.